Our first speaker is Dr. Amato, who has joined us all the way from Brazil. He is president of the Lipedema Association in Brazil. He's an MD, PhD, and MBA. He's an author, physician, and today we're going to hear about his novel approaches to surgery and clinical management of patients with lipedema. Thank you.
I would like to thank you for this opportunity. My name is Alexedre Amato, and I'm a vascular surgeon in Brazil and a lipedema researcher. Today I'll talk about nutrition in lipedema before surgery. I have no financial disclosure or conflicts of interest, maybe a negative disclosure as I'm a surgeon and I'm talking about not operating. I don't know if it could count like this, but as everyone here knows, lipedema is a fat deposition in limbs associated with pain, tenderness, and easy bruising in affected areas. Fat deposition is the most obvious symptom of lipedema. So today I'll talk about lipedema disease, which is very still often misdiagnosed as obesity or lymphedema. But I also believe its symptoms are frequently misplaced in varicose veins. We did a prevalence study in Brazil, and we found that 51% of lipedema patients complained of heaviness in legs, 90% leg pain, and 51% swollen legs. A high number of 48% said that they were already operated of varicose veins. Those symptoms are often associated with varicose veins, but could also be lipedema. My question is, are we operating varicose veins because of lipedema symptoms? And the prevalence we found for lipedema was 12%. At least in Brazil, it is 11 million women. So we must ask, what are the tools we have for lipedema treatment? In one side, we have surgery with liposuction. In the other hand, we have conservative treatment with compression, lymphatic drainage, nutrition, and exercise. But we must understand the disease to properly address it. First, lipedema seems a genetic disease that has many hereditary characteristics, and being a high prevalence disease suggests that it is also a polygenic disease. So there is no surgery that could fix our DNA. Liposuction alone cannot cure lipedema. Also, lipedema is an inflammatory disease. As said in standard of care for lipedema, a hallmark of lipedema tissue is inflammation. The fat tissue worsens with other sources of inflammation, but it also causes more inflammation. Most of the lipedema symptoms are due to this inflammation cycle. If we lower inflammation, we improve quality of life, but we can't use common anti-inflammatory treatments. They don't work and sometimes make it even worse. Steroids, for example. As genetics cannot be changed, the way I see and understand the disease is that it has two important characteristics that should be tracked: fat deposition and cyclic inflammatory symptoms. Fat deposition can be tracked with volume measurement, bioimpedance, and many imaging protocols. And it is important to prevent mobility issues. Cyclic inflammatory symptoms could be palpable tissue nodules, pain, swelling, at least the feeling of swelling, easy bruising, vascular fragility, and livedo reticular. Those symptoms compromise quality of life. That's also measurable. Fat deposition always increases, but it could be very slow and take a full lifetime to be noticeable, or very fast. What increases the fat deposition speed is the inflammation. If we stop or lower inflammation, fat deposition will be slower as any other person without lipedema. More inflammation, more symptoms, and more fat deposition. Worst advanced cases of lipedema are often the result of a lifetime of non-stop inflammation. So I see inflammation as the accelerator of fat deposition. But the inflammation is cyclic during life, with peaks and troughs. Inflammation can be triggered, and it can increase with any acute inflammation. Has anyone seen here a lipedema after a mosquito bite, a trauma, or any food intake inflammation, or any cause of chronic low-grade systemic inflammation? We must study more the inflammation, the inflammatory triggers, but we don't need to understand everything about them to know they must be avoided. They must be tracked, and self-awareness is the key here. Because during inflammation peaks, fat deposition speed increases. And while there is inflammation, most of the obesity treatment does not work properly. It's difficult to lose fat or gain muscle when you are inflamed. So, for example, what happens if you operate during an inflammatory peak? So, you are here in the red dot or green dot, and you operate. So, inflammation is the body answer. Inflammation is the body answer to any aggression, and surgery is an aggression per se, and you will have the worst inflammatory peak ever. And you may ask, why would someone operate during an inflammation peak? Because the symptoms are worse. They are desperate to find a solution. Many won't wait for the proper conservative treatment, and also because they are in the wrong state of mind to make this decision. But what happens if you operate without inflammation? Operating a non-inflamed woman brings outstanding results with a very easy intra- and post-operative care and control. The decision of surgery was well thought. Acceptance and responsibility for self-care was understood, and results are better. But what happens if you operate without conservative treatment at all? Lipedema symptoms will be detached from inflammation. Inflammation will still happen, but will not trigger lipedema symptoms. Inflammation may lower a bit because of the fat trigger for inflammation. Is this good? Well, less pain, less bruises, but inflammation will continue to damage other tissues and bring other kinds of symptoms. Maybe the surgeon who did the surgery won't be there to treat fatigue, depression, gastrointestinal problems, headaches, or many other symptoms and diseases that are related to chronic low-grade inflammation. And probably no one will make the link and see that lipedema was the target when it was there. The target only changed. Well, what happens if you do conservative treatment? You may have a slower fat reduction speed, but you can achieve less symptoms, mobility, and even aesthetical results. What happens if you do conservative treatment and surgery? I believe you can further lower the symptoms baseline, but not change the inflammation. There will still be inflammation. But the most important is the cause and the consequence is treated and controlled. So quality of life is regained and disease is in a short leash. So some food strategies are arising to help control inflammation. I wrote this book about anti-inflammatory diets because I see many inflammation triggers in food we eat. Sorry, it's in Portuguese, so that's, I couldn't translate it yet. But my first option is anti-inflammatory diet, followed by the ketogenic diet. Keto is more effective to lower volume of fat, while anti-inflammatory can significantly lower inflammatory symptoms. I will show you later. But in this study from 2019 from Belgium, Garcia Caballero and colleagues demonstrated in a mouse model that keto diet improves lymphatic vessel function and growth, reducing infiltration of anti-inflammatory immune cells and decreasing edema. I can't read the Russian yet, but Google Translator helped me understand the nature of this paper. So Tatiana in Moscow showed keto diet being effectively used in combination with physical activity in order to reduce body weight, fat mass, and edema in a lipedema patient. In Italy, Canataro and colleagues reported a case of significant weight loss of 41 kilos and improvement in pain and quality of life. In Boston, Keith and colleagues raised the hypothesis and possible mechanism by which patients adopting a ketogenic diet can alleviate symptoms of lipedema. In Norway, Vude and colleagues demonstrated that ketogenic diet is associated with reduction in perceived pain and improvement in quality of life in patients with lipedema. So, we have seen that lowering inflammation before surgery brings a better postoperative care. So, removing any inflammation trigger is important, and food intolerance seems to be the most common one. Not the only one, but the most common one. We can be sure we removed the inflammation trigger when the symptoms are controlled. And we trust removing all fat clinically possible before surgery will make a better end result. For those that food intake is the trigger, knowledge of what is causing inflammation is very useful, as it allows to follow any other dieting strategy. Trying many strategies and understand which one is better and easier for keeping in a long term is also very important. Understand what are the triggers that causes inflammation, control the ones that can be controlled, avoid the ones that can be avoidable, and protect yourself from the ones that cannot be modified. How can we track which food is causing inflammation? That's a good question. There is an IgG Food testing panel that is very controversial, and this controversy could be a whole another lesson, but it could show at least the food that is currently activating IgG response in body. So resiliency is key. It is the ability to manage challenges, quickly recovering from them, and even growing and improving as a result of these challenges. I like to say that to error is human, and that's not a problem, but we must learn with error and improve. To eat something that causes inflammation and triggers inflammation again, it's not a problem. It helps to change the stigma of a diet to a choice of food. It's wrong is to get inflammation and then keep inflamed. So we did a small study with IgG Food testing panel to track the food intake in lipedema patients comparing to non-lipedema patients. We compared to 80 lipedema patients with 155 non-lipedema patients doing a 226 food panel. It's not published yet. So after comparing the populations, we could note that some food had less IgG influence in lipedema patients than normal people, like soybean, egg white, or potato, for example. But also appeared casein, cow milk, and wheat that are considered highly inflammatory. Probably the influence of those foods are not IgG related. Some foods that appeared for lipedema patients are very interesting or very common, like sunflower seeds, fig, agar-agar, egg yolk, rice, beer yeast, Brazil nut. I currently believe that IgG is only one aspect of the problem and could at least guide us to the most consumed food by the patient. One interesting food is the Brazilian tapioca, which never triggered an IgG in my patients. And it's interesting because tapioca could substitute bread easily or wheat. Well, this is a case that I published, but I never showed the later stage. So in this example, after removing her most important food trigger, which was wheat and sugar, she had no more pain and then went full keto. We could clinically remove 11 liters of fat in legs without surgery. And then, only then, we operate and removed 5 more liters with very good and safe results. So this is the case that is published, and I published only till the conservative treatment. I never showed the end phase after surgery. So here it is. In this other example, I would like to point out that it's possible to remove more fat from lower limbs safely from conservative treatment than with surgery. The initial conservative treatment were 12 liters of fat were removed without any incision, and a lot of quality of life improvement. Then we opted to operate and removed 5 more liters of fat, and she had an erysipelas after surgery, which was treated but left a few stains. We are solving that now. Anyway, it's much safer to remove fat from clinical treatment than surgery. Concluding, surgery is not a substitute to conservative treatment. All patients need to focus on long-term quality of life with conservative treatment. Surgery is not a cure for inflammation. It is much safer and productive to lose fat in legs clinically and only then removing surgically only the necessary, than removing all fat at once. Some cases require surgery earlier, mainly because of mobility difficulties, and inflammation is often misinterpreted as aesthetical complaints. So if you treat inflammation but don't remove the trigger, it's like pressing the speed pedal and the brake at the same time. You won't move. Thank you.